This is Selma Schimmel in Los Angeles. We are at the Oncology Nursing Society 11th Research Conference, where our discussion continues with the senior oncology nurses here that are presenting their research data, talking about areas of interest, as we are doing with you and Berger. Professor Dorothy Hodges-Olson, Endowed Chair in Nursing. You're the director of the PhD program at the College of Nursing, Advanced Practice Nurse in Oncology at the University of Nebraska Medical Center.
That's right.
So let's talk about what does it mean, those words, cancer-related fatigue, by definition.
Right. So one of the important things to determine when someone talks about fatigue, and in the clinics all over the United States today, we hope that every patient at every encounter is asked, just like they are with pain, can you rate your fatigue? 0 being no fatigue, 10 being the worst fatigue you can imagine. And when someone scores 4 or higher, that indicates to us that there's a need for intervention. And we can go ahead and ask them then, for example, if they have comorbidities or other illnesses, which they often do. We determine to make sure, for example, that the heart disease or the lung disease is under good control, because the fatigue may be coming from those other comorbidities. But is this a fatigue that is new to you since you were diagnosed with cancer? And let's talk about how it's playing out.
What about the cancer types? Do you see cancer-related fatigue more dominant with certain cancers related to the treatment that are used for those diseases?
Well, it's interesting because most of the research began in cancer-related fatigue with women with breast cancer. Number one, it's very prevalent. And number one, a lot of women have daughters that they're concerned about someday. And when you say we want to try to study this so that people that come behind you can have a better experience than you're having, they tend to sign up for studies. And so we really have had the most success in working with women with breast cancer. But then you may recall there was a period of time when women got very aggressive breast cancer treatment, actually bone marrow transplants, and they're not doing that any longer. And we did some studies at that time and found out that just because you got more aggressive treatment did not necessarily equate with higher levels of fatigue. So there's factors within the individual in addition to what chemotherapy or what other treatments they might get that seem to play out.
Why don't we understand more about the root of cancer-related fatigue?
Well, that's a really good question, and actually there's many presentations at this conference. I just came from one that demonstrated that there are genetic alterations, so perhaps there's things about us from our genetics that make us more likely to have high fatigue versus low fatigue. But it's a very elusive symptom because when a person has cancer, obviously their body's going through lots of changes. We call it inflammation. Then we give them treatment, there's more inflammation. And then these cytokines, these cells that are supposed to be on guard for when the body is attacked, they say, oh, I better go out there and try to figure out what the attack is. And so those cytokines cause a general fatigue that kind of masks what might be their true mechanism deeper down.
And also, I would imagine if one is dealing with depression, which can accompany the cancer experience, and that can provoke fatigue, it's very hard to tell what's the real core source of where's this fatigue coming from.
That's right. But we do know that almost 100% of people that are depressed talk about that they have fatigue, but not all cancer patients with fatigue are depressed. And one of the first things to do when I talked about ruling out comorbidities, I talked about heart disease or lung disease, but depression is right up there at the top. They tend to travel together, and so that's a really important thing to rule out and to seek treatment for.
Let's talk about what patients need to know going into therapy, how they should communicate their symptoms of fatigue with their doctors, and most importantly with their oncology nurses, because, well, patients tend to think that it's the doctor that really stays on top of everything that's going on. I think it's the oncology nurse that has more time to spend with the patient and begin to put the pieces together, and then may be your best advocate in communicating really what's going on with you to the doctor.
That's right. So let's start at the beginning. You said what patients need to know at the beginning. I've actually enrolled many women in studies, maybe 400 women in studies, and if we approach them before they've ever first had chemo and say, Fatigue is going to be a problem that the majority of patients, like 95% of patients, experience, and we have an intervention for you that we would like to get started right away before you start treatment. We had a refusal rate, maybe 20–25%. Oh, I'm not fatigued, you know, I don't need your study. So I think the part of people understanding that fatigue is something that comes along with the treatment for almost everybody, you know. So that's an important thing to know. And the important thing to know too is that we have ways of assessing and trying to intervene right away. Actually, several studies have been published in the last year that shows that when people report a score before they've had treatment, so let's say someone reported a fatigue score of 5 on that 0 to 10, that is the strongest predictor of how they're going to feel like at 3 months and 6 months. So the ones that say 1 or 2, maybe just a little bit of education. The one that say 5, we need to talk about like physical activity from the very beginning and not dropping that out of their lifestyle even though they're getting cancer treatment.
What is the role of one's hemoglobin when it comes to fatigue?
Well, there's also been a lot of research done because of the many products that are used to raise hemoglobin in addition to transfusions. And actually, the human body is such an interesting specimen, I guess we'll call it. We know there is a role, and when people reach what we would call, again, moderate to severe anemia, almost exclusively people report being tired. But just as in health, people can have a variety of hemoglobin levels, and it's not necessarily attached to their feeling of fatigue because it's such a perception as opposed to a biological measure. So we would say it's non-conclusive.
What are the tricks of helpful hints? I've heard frequent small meals, things like that, that we can help our viewers understand if they're going through cancer treatment, how they can help manage and maybe minimize the feelings of fatigue.
Well, what we can tell you now at the beginning of 2011 is that as never before, we have had many studies now that have come to the conclusion that physical activity, and the American Cancer Society and the American College of Sports Medicine published a paper in 2010 that said cancer patients should strive for the same physical activity pattern that healthy Americans should. And so that means, depending on their level, up to 150 minutes a week is our goal. So 5 days a week, 30 minutes. Now there's obviously many people that can't do that, but obviously women with breast cancer, early stage breast cancer, often can. And so whether it would be small bouts of 10 or 15 minutes, just working up like by week to try to build up that stamina, and not to have those long stretches of time like when women get chemotherapy for 6 or 8 months where they're not active. So that's the number one. And the other one is depending on the psychological coping, feelings of loss of control, feeling irritable, anxious, depressed, that there's a variety of psychosocial interventions such as yoga showing a lot of evidence, massage therapy, which many people like, group support group, perhaps individual counseling. But the most important thing is to find the type of psychosocial support that will work for you and then use it throughout treatment.
What about the role of nutrition?
Okay, so a lot depends on the type of cancer. I worked with people, for example, that have had a loss of 75 pounds before they've come to the doctor with maybe head and neck cancer. And nutrition is huge there, isn't it? I mean, you just imagine, if back to doing blood work, you do a lab report and everything about their body is really stressed. So that becomes number one, that it's more important than physical activity, really, or psychosocial. But in general, many cancer patients are actually well-nourished, if not overnourished, or obese or overweight in today's society. And so in general, when you were talking about, the important thing is to maintain a diet that is just what we're all supposed to be striving for, and that would be healthy amounts of calories that are a balance of protein and fats and carbohydrates. We find that when people are nauseous, they tend to eat, like when you always think about getting soda crackers if you're nauseous, that many people that are nauseous have a variety of carbohydrates all day and don't have any protein, and they don't lose weight, you know, so it doesn't look like they're malnourished, but actually they're not giving their body the protein.
They're not getting the nutrients.
At the same time, they're getting treatments that break down the muscle mass of their body, you know, so they need the protein.
Would you think it would be helpful for patients to keep a journal also of sort of being able to make notations of when they feel their fatigue peaks, or any factors that would help you as an oncology nurse, not only in the research setting, but when your patients come to the office, that they could report to the nurse?
So we've actually instituted something like that at the University of Nebraska. We call it their diary, and it's a little card that they can open up that has the month, and then they can fold it back up and put it in their wallet. And they can just write down a fatigue score. Like in general, my fatigue today was 4 or 6 or 1. But even through the National Comprehensive Cancer Network, I'm the team captain for cancer-related fatigue. And we really don't want people to think about their fatigue every day if they don't have to, So kind of journaling and putting down a daily score, it might be good to just say, I think about it in terms of a week. And if I haven't even thought about it for a day or 2 or 3, that's good, And then the other part about that journaling is one of the psychosocial interventions. So many people feel that's helpful. Other people just don't seem to benefit from it.
So in closing, in today's research, compared to where we started out in this understanding of cancer-related fatigue, what is the current research? How are you conducting it as far as the changes to get better an understanding and enhance your knowledge?
Okay, so a real good take-home message to everybody is, now we know physical activity probably works. We know that psychosocial interventions work. Nutrition is a third major area. My major area is how to enhance sleep and sleep-wake activity rest. So there's all areas that are being pursued, but we don't know what works, with whom, like what kind of cancer or what kind of treatment, at what time, early in the treatment or wait till there's a survivor, and kind of at what cost. We've done a lot of research trying to kind of deliver the Cadillac model. But if we're going to have so many cancer patients, we're up to 12 million survivors, we've got to come up with some cost-effective interventions that are fairly efficient, too, that would involve 3 to 5 visits, maybe, as opposed to 12 visits for some type of therapy.
Given your academic accomplishments, there were many areas of oncology that you could have invested in. And as a survivor, thank you for taking the issue of cancer-related fatigue on.
Well, thank you. My mother passed away of cancer, and that was the symptom that she had that I wanted to do something about.
You see, there's always a private story.
That's right.
And what motivates us and allows us to take a painful experience and make it better and hopefully make a difference for other people.
That's right.
Thank you.
You bet.
Ann
You're
Berger.
welcome.